Hello, everyone. I'm Becky McGregor, your APS Employee Wellness Coordinator, and welcome to your Blue Cross Blue Shield of New Mexico presentation for your benefits starting January 1st, 2025. With us today is Amanda Romero, and she's going to walk you through the benefits that you have through Blue Cross Blue Shield. This is the proactive pursuit of our health and well-being, and really, to be proactive, we start with knowing our benefits and knowing our resources, and that's what Amanda is going to walk you through today. Open switch enrollment is October 1st through the 16th. You can find all of the information, including cost comparisons and your premium payroll deductions on www.aps.edu/open-enrollment. So please make sure you watch the presentation and then go to your open enrollment landing page. For employees starting after January 1st, 2025, this presentation also serves as the information about Blue Cross Blue Shield. So if you're trying to choose between plans, this presentation will give you all the information you need to know on the services that Blue Cross Blue Shield offers. And with that, I want to toss it over to Amanda, and she is going to walk you through your open enrollment for 2025.
Awesome. Thank you, Becky. Hi, everyone. As Becky mentioned, my name is Amanda Romero, Account Executive at Blue Cross Blue Shield. Thank you for taking the time to review your 2025 Blue Cross Blue Shield benefits. On the agenda today, we are going to review your Blue Cross Blue Shield plans and features. We're going to review what's new to you for 2025. You're going to review customer service, online tools and resources, and then we'll finalize by going over your health and wellness options that are available to you through your plan. So why choose Blue? You have a variety of doctors and hospitals. We have the largest network nationwide, so you're going to have coverage everywhere you go, whether you're in California, New York, you are able to find a provider that is in network. Within your Blue Cross Blue Shield plan and being an APS employee and member, you will have personalized customer service. You're going to have access to a variety of tools and resources, health and wellness programs, and digital capabilities. So as Becky mentioned, you have a variety of different plans to choose from, whatever suits you best for you and your family. While you're looking at your different plan options, there's some things that I want to just point out that you can think about. So number one, provider availability. You want to make sure that you're able to see the doctors, hospitals, and facilities that you want to see. So do your homework and review the providers that are within the networks on the different plans that are available to you. You want to look at your costs. How much is it going to cost you just to have insurance? How much do you pay per paycheck? Then you're also going to look at your benefit payments. How much will you pay per year for the services, your co-pays, your deductibles, your out-of-pocket maximum? And then lastly, of course, look at the medical services that you regularly get or any services that you have planned and kind of look at those and see how much you're going to have to go to the doctor and what those costs are going to be. We have a great tool that I'll talk about that is a provider or that is a cost estimator tool that can help you project the costs of what your services may be for the future. So now we'll talk about what's new for 2025. One of the things that are new is effective January 1, 2025, APS will be moving to an EPO network. What that stands for is an exclusive provider organization. You are going to still have the same access to the same providers that you do today, still nationwide. You're going to still have protection from balance billing. You're not going to have to file any claim forms, no referrals. You don't need to pick a PCP. The only thing that is happening is the out-of-network benefits are going to be dropping off. So you'll see on the next slide, we'll go over that, but everything is still the same, still that nationwide network. If you already have or already established with the provider, that is not changing. So here on this slide, you will see there the out-of-network benefits effective January 1. Those are going to be considered not covered. So if you end up going to see a non-contracted provider, those will not be covered in 2025. The caveat there is for emergency and urgent care services. If you have initial treatment for a medical emergency or an urgent care visit, it will be covered under your in-network benefits if you were to see an out-of-network urgent care emergency room for that initial medical service treatment. However, any follow-up treatment will not be covered. So just keep that in mind when getting services done. So, other than that, all of your benefits will remain the same. You all still have your very well rich benefits that APS offers you. You will see there you have your deductibles, a three-tier deductible, just depending on how you're enrolled. The deductible only applies to certain services. So, you'll see there anywhere you see a 20% on the screen, that is when your deductible applies. Other than that, you do not need to pay the deductible. Your deductible, if you're enrolled employee only, is 1,000. If you're enrolled employee plus one, it is 2,000. And then if you're enrolled employee plus two or more, you are going to have a $2,500 deductible. That deductible, again, will only apply when you have benefits that require that deductible, such as a hospital stay. So if you have a hospital stay and you're enrolled employee only, you'll have to pay that $1,000 deductible. Then insurance starts kicking in, you're going to pay 20%. The insurance will pay 80% until you meet your out-of-pocket maximum. So there on that next line, you're going to see your out-of-pocket maximum. Again, employee only is 5,000. Employee plus one or more employee plus one, I'm sorry, is 10,000, and employee plus one or more is going to be 12,500. I like to think as my out-of-pocket maximum as my safety bucket. That is going to be the most that I'm going to pay per calendar year for covered services. So everything goes towards my out-of-pocket maximum. So my deductibles, my co-pays, my co-insurance. Once you hit that out-of-pocket maximum, your insurance is going to pay 100% of all covered services for the remainder of the year. Okay. And then there your co-insurance. So any benefits that apply co-insurance, you're going to be responsible for 20%. Insurance will cover 80%. All preventative services are going to be covered at 100% as long as you see an in-network contracted provider. So make sure you are getting those preventative services. COVID is going to be covered based on place of treatment and type of service. Your MD Live benefits for virtual health as well as your mental health are going to be covered at 100%. Behavioral health, substance abuse, office visits are going to be covered at 100%. Specialist visits are covered at $60. Your PCP visits at $30 copay. Allergy office visits and allergy extract serum, those are your copays are listed there, $60 and $10 respectively. And then lab x-rays, EKGs, you're going to pay $30 per day. And then your advanced imaging. If you go to a freestanding image center, it's going to be a $100 copay a day. If you get these when you're in the hospital, you are going to pay 20% after deductible. Urgent care covered after a $75 copay, emergency room covered after a $450 copay, and then your outpatient facility and inpatient hospitalization is going to be covered at 20% after deductible. Okay, so no changes to your benefits there. As I mentioned, we're dropping off that out of network coverage. So if you need help finding a provider, you can utilize your provider finder. On here, you'll see that provider finder has a lot of resources that are available to you. You can find in-network providers, medical groups, hospitals, urgent cares. You can look based on where you're located. So if you're traveling somewhere, you need to find an urgent care or a hospital or a provider that you need to see, you can just utilize provider finder, enter the zip code, and locate a provider. You can also compare the quality ratings of providers as well as write any feedback that you'd like. And then you can also utilize the cost estimator tool within Provider Finder, which we'll talk about here shortly. If you need help finding a provider, APS has a concierge customer service line. You can contact Optum at this phone number here or Loveless at that phone number there. You're able to contact them, just let them know that you're an APS employee or family member that's covered by Blue Cross Blue Shield, and they'll be more than happy to help you find a provider. You could also go on to bcbsnm.com and utilize the provider finder that I had talked about. And then here is your cost estimator tool. As I had mentioned in the previous slide, located under Provider Finder, you are able to utilize the cost estimator tool to look at different services to see how much they could potentially cost at different facilities. So you can put in there, what you're getting a knee surgery. You can look at the different providers that offer knee surgery or knee replacement. And within that, they'll give you a cost estimate based on your plan and your out-of-pocket costs. So if you've already already paid your deductible or you've already paid some of your out-of-pocket maximum. It will give you a true representation based on your unique experience. MD Live, which are your virtual visits, are still available to you 24/7, 365. MD Live is a provider, so you are able to contact them at any time for you or anybody that is covered under your medical plan. Here, they're able to treat, diagnose, and prescribe short-term medications. So anytime that you have a cold, you don't want to spend time in urgent care, you don't want to spend time in the emergency room, especially if you have a sick child, you don't want to take them to get more germs. You could call MD Live and get treated by a provider virtually, either on your phone, a laptop, anywhere that you have access to, doing a video visit, whatever it may be, you can contact MD Live. All of the ways that you can contact MD Live are here on the screen. You can call them, you can go to the website, you can text, or you can download the app. 24/7 Nurse Line is still available to you. You have access to a nurse where they can provide you around the clock advice and wellness advice. Let's say that you want to call and see, can I give my child at this age some Tylenol or just need some expert advice? You can call them anytime and get that advice that you need. The phone number there is available to you. I encourage you to put that in your phone because you never know when you're going to need it. And then new, as of right now, you do not need to wait till January 1, 2025, is Galileo. So Blue Cross Blue Shield recognizes there is a need for providers. It also takes forever to get into our providers sometimes weeks, sometimes months. So because there are those access issues, Blue Cross Blue Shield has partnered with Galileo. They are now a contracted provider within your Blue Cross Blue Shield APS plan. Galileo has over 20 disciplines that they're able to provide you virtually. So you'll see there's pediatrics, there's PCP, there's infectious disease, there's so many different types of disciplines that they're able to help with, that you can contact a provider and see them virtually. You are also able to use it within an app. You're able to message the provider 24/7. You also have access to it in English or Spanish, whatever is what is more capable for you at that time. Here is what the member will experience. You as the member, you can consult with the medical expert. You'll request an appointment. They'll call you as soon as possible. You'll have that visit. They'll give you extensive review notes based on your service that you just received, any follow-up treatment that you may need. They'll schedule follow-up appointments within Galileo for you. If you end up seeing a PCP and you end up needing to see a specialist within Galileo, they can set that appointment up for you. You can request lab tests. The provider can do that for you. They are just like a normal provider. They're just able to treat you the convenient way virtually. They could also request a referral for you, and they can also prescribe you medications. The one thing that I absolutely love about Galileo is the PCP aspect. You can have your primary care provider within Galileo and get seen by your primary care physician 24/7, 365, again from the comfort of your home and what is more convenient for you. So, like I said, you can get started now if you'd like. You can scan the barcode or you can visit galileo.health/bcbsnm.com. You'll create an account, you can install the app, and you can use the app to create your appointment. Again, it is available to you today. The charges for this is going to be based on your plan design. So, based on if you see a PCP, you're going to get the PCP copay. If you see a specialist, it's going to be that specialist copay. So get started with Galileo today. Still available is going to be the digital mental health program, Learn to Live. This is available to all employees and their family members that are 13 years or older. We know that mental health is so important, and we want to make sure that everyone is able to get treated the right way, the convenient way, and get get the services that they need when it comes to mental health. This online program allows you to work with a provider, a personal coach, one on one, either by phone, text, or email, anytime, anywhere. They can treat you for stress, anxiety, depression, social anxiety, panic, substance abuse, anything like that. We really encourage you to utilize Learn to Live. You can access this by logging into your Blue Access for members. Choose the Wellness tab and then find the digital mental health. And at that point, you can access the digital Learn to Live. We know that you're mobile, so we're mobile too. We want to make sure that you have access to all of your resources anytime, anywhere, wherever you go. So, with that, we do have a mobile app that you're able to access a lot of the same resources that you are able to online. You can go to bcbsnm.com. We have Blue Access for members that's available online as well as in the app. And then you also can sign up for text messages to receive any updates that's related to you and your Blue Cross Blue Shield plan. So, Blue Access for members, I've mentioned that a few times. That is your personalized support tool where you're able to review all of your benefits. You're able to manage your health plan. You can look for a provider, utilize that cost estimator tool, look for a doctor. You can also update your communication preferences. Find all of your health and wellness materials, that digital mental health program, all of that is available to you 24/7, 365 on Blue Access for members, either online or through the app. So sign up for Blue Access for members today. If you haven't already, all you're going to do is go to bcbsnm.com and then you're going to log into Blue Access for members. Again, if you're a new user, you're just going to click sign up. Make sure that you have your ID number. You're going to need your ID number the first time that you log in, and then you can set up your credentials that are easy for you to remember the next time that you need to log into Blue Access for members. And then, as I mentioned, you have the availability to have the app. Same thing here. You can download the app, make sure that you have your ID number. And then once you enter in your ID number in the app, you'll then have access to all of your benefit information at the palm of your hands. Preventative coverage. I had mentioned earlier that preventative coverage is covered at 100% as long as you see an in network provider. So make sure that you are getting your preventative visits and screenings yearly. We recommend that you get your routine gender and age specific preventative care and screenings. You also want to make sure that you are getting the screenings that are applicable to you and your age. So if you have any questions on that or you want to look that up, you're able to go onto your Blue Access for members and look at this through your wellness tab as well. And then women preventative services, again, covered at 100%. Women want to make sure that they do get their preventative services that are required per your guidelines. There's those as well, women preventative visits, screenings for diabetes, sexual transmitted infection counseling, HIV screenings, breastfeeding support. So make sure that you utilize the benefits that are available to you that are covered at 100% under your APS Blue Cross Blue Shield plan. Prior authorizations. As you know, a prior authorization is a process that is used to determine whether a procedure or a medical service meets the requirements of your health plan. Some services do require a pre authorization, so I encourage you to look through your medical benefit booklet or call the customer service line on the back of your ID to make sure that you are getting that prior authorization prior to getting that service so that none of your medical benefits are denied. You can work directly with your provider and they can submit that prior authorization on your behalf. And now let's talk about your well-being, health and well-being programs that are available to you. As a Blue Cross Blue Shield member, you have access to a variety of different programs that are available. There's Well on Target, that digital mental health, 24/7 nurse line, the fitness program, women's and family health, and digital coaching programs that are available to you. Within Blue Access for members, you also have access to your member wellness program. Within this, or wellness portal, I'm sorry, it's a program as well. You have access to your health assessment. You have access to digital self-management programs, trackers and tools, health and wellness content, secured messaging, the fitness program. You can earn Blue Points, which you're able to redeem within our shopping mall. And you also have the ability to download the mobile app Always On, which has all of your wellness content on one app. So the health assessment, this health assessment is integrated within your wellness portal. You're able to just answer a few short questions. It takes less than 10-15 minutes. You can, and within this assessment, you're able to identify areas of improvement or where you may want to focus on and find digital content that is available to you on the portal that you can start working on those areas of improvement. You can talk to your provider on this. With this, you're able to complete this in the app as well, and you earn points for completing your health assessment. And then there are a lot of digital self-management programs that are available to you. There's a lot of wellness topics as well. We have interactive programs that are available that include improving your sleep, living with diabetes, quitting tobacco. And then we also have educational topics that are available to you that you can sign up to receive information on: living with asthma, preventing diabetes, improving your cholesterol, having a healthy pregnancy. All of these are available to you at no additional cost. They are all of value added benefits and educational resources that are available on your wellness portal. And I had mentioned Blue Points. So Blue Points are a great way for you to earn their points that are a great way for you to enhance your ability to be and do different wellness activities. So if you do that health assessment, if you sign up for a digital, one of those interactive programs that we just talked about on the previous slide, if you set up a tracker tool, so you set up your Fitbit or a tracker device within your Blue Cross Blue Shield portal, you get access to, you go to the gym and you work out and you gain points for doing all of these healthy activities. Within this, when you do these Blue Points, you can then, as once you have enough, you can then redeem them in the shopping mall. You can get Amazon gift cards, you can get water bottles, a bike, different health and wellness options that are available to you to redeem your points for, just for you for having living that healthy lifestyle. I had mentioned the Always On app. So this is your wellness app. So there's the Blue Access for Members app, and then there's the Always On mobile app. The Always On mobile app is specific for your wellness. So you're able to do secure messaging with your health coach. You can complete your health assessment on the app. You can look at your health dashboard and trackers. You can look at your health points balance, as well as do different wellness challenges that helps you earn those Blue Points. The gym membership, there are no changes to the gym membership. If you have the gym membership today, we have a flexible gym network. So what that means is we have a choice of different networks that fits your budget as well as your preference. So there's a digital only option where you have the option to have just a digital only platform where you are able to have access to over 5,000 different digital workouts anytime, anywhere. That is going to be $10 a month. Then you have the base, the core, the power, and the elite option. What this is from when you go from the base to the elite, it just has more gyms in network. Okay, so think of these as different networks of gyms. The higher the price, the more gyms that are in network. These are nationwide networks. So let's say that you are here and you go to Planet Fitness here in Albuquerque, and then you end up traveling to Chicago and there's a YMCA in Chicago and you want to go to that gym. You're able to go to those gyms as long as they fall within that network. You also have the ability to do studio class network, which is available to you, and then family friendly family-friendly options are available. You'll see here on the slide, I did list the different gyms that are local that fall within the different tiers. You'll see that if the gym is in the base tier, it's also going to be in the next tier. So it'll be available in the core tier. Then it'll also fall and drop into the power tier and so on and so forth. So if you were to elect the base tier, it does have your Planet Fitness and your Choose Fitness. Keep in mind that is going to be the base level of what Choose and Planet Fitness offers. So Planet Fitness has that Black Card membership, or they have the base membership. The option that is here under the base is going to be the base option within Planet Fitness. And then the Choose Fitness is also going to be that base option. That does not include the fitness class program. So keep that in mind when trying to choose this. But if you were to elect the base option, it is $19 a month. So if you wanted to go to Planet Fitness in the morning, you're able to go to Planet Fitness in the morning, then you can go to Choose in the afternoon. So that's the beauty of having these networks, is you're able to access these different gyms, multiple gyms within this one membership. And then just for being a Blue Cross Blue Shield member, you have access to Blue 365 discount program. This is exclusive for you members. This gives you discounts for a variety of different national local retailers. So you can get discounts on eyeglasses, you can get discounts on Skechers, on fitness nutritional programs. You can get access, different discounts on eating healthy, dental work that may not be covered under your dental plan, implants, anything like that. They always change the different discounts that are offering. So I encourage you, next time you go shopping, just go and scroll onto Blue Access for members, look at your Blue 365 deals that are available and see what discounts that you can get before you go out shopping, especially, if you're going shopping for kids' clothes or anything like that. The more discounts, the more you can save. And then Wonder is a skills-based digital weight loss program, syndrome reversal program that helps with weight management as well as diabetes prevention program. This is still available to you. So this is not a new program, it's still available. We encourage you to check it out. If you want to start by, diabetes prevention, if your health assessment said that was an area of improvement, this is a great way to start. It is 100% covered by the plan. It's no cost to the member. You're able to work one-on-one with a coach to help you get the goals that you want to get to. You can start by going to wonderhealth.com/APS. Women's and Family Health, this is another program that is available to you. So no matter what stage in life that you're in, whether you are pre-pregnancy, pregnancy, post-pregnancy, raising the child in menopause, there's different programs that are available to you, or different options that are available to you that are no cost. So we work with Ovia Health, who that's what the app is called. And just based on whatever stage you're in, if you're in the fertility stage, you'll download the Ovia fertility app, and it could help you with your fertility journey. If you're in the menopause state of your life, you can download the Ovia menopause one, and it could help you with that stage of your life. It's just another value added program that is available to you. You have access to a lot of specialists on there. You can contact the specialists within the app and get real time feedback and answers to your questions that you may have, as well as tips and tricks to help you through those different stages in your life. New this year for 2025 is going to be cancer services and support. APS recognizes that cancer diagnosis can change your life forever, and they want to provide you the most support available to you and your family members during this difficult time. So, APS has decided to offer these cancer services and support January 1, 2025. They're actually enhanced services. You do have services today, but these are more enhanced. So, for cancer support, if you end up having a diagnosis for cancer or a family member that is enrolled on your plan, you're going to have access to a skilled cancer care nurse. They're going to be assigned to you and they're available to do hands-on with you. They're going to be with you every step of the way. You'll be assigned to a nurse, and they're able to help prepare you for doctor visits, answer any questions, make sure that your claims are processing correctly, help you if you want second opinions, anything like that. They're also able to help you with that emotional support. And then also that's included is going to be the expert review and support. Sometimes, you just want to get an additional opinion, a second opinion. You want somebody to look at your specific situation. It may be a unique one or a rare diagnosis that you have. You have the ability to request an expert review on your case. You'll just request that through your cancer care nurse that is assigned to you, and they're able to review your specific case, provide recommendations, work with your provider, and then if a clinical trial is suggested, they can also help you with that as well. Again, this is available to you and any family members that are covered under your plan that may have a cancer diagnosis. And to get started, you'll just need to call the number on the back of your ID card. We went over a lot of information today. I hope it was valuable to you to make the best decision for your medical plans based on you and your family's unique needs. I encourage you to be a smart consumer. Medical care and just like everything else continues to increase. Inflation is a real thing on every aspect of our life. So ways that you can be a smart consumer with your medical plan is use an in-network provider. Research costs with that provider within the provider finder. Use that cost estimator tool. Review your explanation of benefits that are sent and your bills sent by a provider. Make sure that your claims are processed correctly. And if you need help reviewing that, we're here to help here at Blue Cross Blue Shield. Utilize your wellness benefits. Get that health assessment done. Utilize all of that health and wellness content that we reviewed to help you have a healthy lifestyle. See your physician regularly. Look at different cost options for your health plan, and then just visit BlueCrossBlueShieldNM.com. Use your Blue Access for members. Utilize your wellness program. That is available to you through your Blue Cross Blue Shield plan. And if you ever need anything, customer service is here to help you. Customer service number is right there. It will also be on the back of your ID card. So you can call customer service for anything that you may need related to your Blue Cross Blue Shield plan. Claims, medical benefit coverage, ID requests, navigating the digital tools and resources that we went over today, or transition of care, which can relate to if you were covered on a different health plan and you decide that you want to come to Blue Cross Blue Shield in 2025. Set up transition of care so that you can stay with your provider. Maybe your provider isn't in network with Blue Cross Blue Shields, but it was in network with your previous carrier. You can set up transition of care to where we will cover your benefits at an in-network level if you have that transition of care in place. So transition of care is applicable for certain diagnoses, such as, if you're going through a cancer treatment or you have a pregnancy that you're going through at the moment. Well, thank you for taking the time to review your 2025 Blue Cross Blue Shield benefits. Again, my name is Amanda Romero, Account Executive at Blue Cross Blue Shield, and I appreciate the time that I had with you today. Thank you, Becky.
Thank you, Amanda. And so a couple of things through the presentation that I just wanted to highlight, because this is the proactive pursuit of health and well-being. And we were really intentional about titling that for our open enrollment because we want people to be proactive. And so one of the things to just point out for everyone, Amanda mentioned that we are now going into an EPO type of plan for 2025, and that is in network only. So there are no out of network. And Amanda kept kind of bringing that back, that there are no out of network benefits outside of ER and urgent care. So we need to be proactive in just making sure that you are looking up your provider finder tool. And one of the things that when I talk to employees, when you're calling up a provider, if they say they take Blue Cross versus in-network, there's sometimes a difference. Providers might take Blue Cross Blue Shield. That doesn't mean they're in-network with them. And that is a distinction, unfortunately, that's not always made, so just know that as a smart consumer, when you're calling a provider, make sure that they are in-network, because they'll take Blue Cross Blue Shield. That doesn't mean they're in-network with them. That is something that I know personally I found out on my own years ago, and I just want to make sure that you all have that. The other thing, proactive smart consumer. Blue Cross makes it really easy with their app and the Blue Access for members. And many of you out there know that one of the things that I tell you on a continual basis is to log in and set up your account, download your app, and get all of that ready and set before you need it. Because when we're sick or when we're in crisis, the last thing we want to do is have to figure out and navigate our healthcare benefits. So if you have your app, and you have it already set up and you have your MD Live already set up, that's one less step you have to take. That's being proactive in your pursuit. Get all of that done ahead of time so that you don't have to do it in the moment when you need it and your loved one is sick or you're sick. Sign up for, when it talks about communication preferences, please sign up for their emails and their text messages. They send information that's relevant for you and for your health journey. And the more connected you are to your benefits and your medical plan, the more proactive you can be about those changes. And I get these questions all the time. Well on Target is Blue Cross Blue Shield wellness and well-being system. At APS, it's a great thing that we have a whole well-being program, Wellness at Work. However, if you just want to access your Blue Access for Members Well on Target program, just do that. It's a wonderful app. You do get points. Those are separate from the overall wellness incentive program. And we know that that can be a little bit confusing. But if you just want to hone in on one thing and use your Blue Cross Blue Shield Well on Target, then just use that and do your health assessment and earn your points and get your rewards. And don't worry about all the other stuff that we have. Focus in on what you need and just narrow your focus so that you can kind of stay in that proactive pursuit for 2025. So I just want to make sure I distinguish that. Yes, we do have an overarching well-being program. However, Blue Cross also offers a well-being program that's included with the benefits that we offer you. And so I don't want you to, get confused with that. Just go in and use it, one or the other. One of the things that Amanda mentioned was the health coaching, which we haven't really highlighted as much with Blue Cross, but you have access to health coaching through Blue Cross Blue Shield as well. And I encourage you to use that. Again, we do offer quite a bit of resources for you, but being proactive in that pursuit means use the health coaching that you have available and those tools with Well on Target that you have available. I keep saying the proactive pursuit of health and well-being. Our open enrollment, again, is the 1st through the 16th. Your employee wellness fair is October 8th and 9th from 2:30 to 6 p.m. And if we really want to stay in this mode of being proactive, this is your one-stop shop. This is your place where you can get your personalized support, all-in-one access to your health plan providers, your vision, dental, retirement savings plan vendors. All of these different people are coming together in one place for 2 days. So you can knock it all out. Come to the wellness fair. If you have questions about Blue Cross Blue Shield, you can talk to Amanda or another representative there. We also have vaccinations, mammograms, eye exams. Blue Cross Blue Shield has their caravan, and we're going to have blood glucose, blood pressure, and cholesterol screens. And then we have wellness consults going on as well. So we're not going to leave you hanging at the wellness fair. I want you to come on out and get your questions answered, get your vaccines if you need them, mammograms, eye exams, and let's start this journey in 2025 with the right mindset so that we can prevent these higher costs. I always say we have to be proactive. And one of the best ways we can do it is by being intentional with our health and well-being. So thank you all so much for, tuning into this presentation. And like I said, this does serve for your 2025 benefits, but all of your information is on this one landing page that you can access, and that URL is at the bottom of the screen. I want to thank Amanda again for her presentation. If you have any questions, you can reach out to Employee Benefits or Employee Wellness, and we appreciate you all taking your time to learn your benefits. Amanda, anything else?
That's it. Becky, thank you so much.
Thank you all.